Okay, my name is Samantha. I'm going to be your nurse today. I'm going to be doing a physical assessment on you. Can you just please state your name and date of birth?
Angela Maria Suarez, June 23rd, 1989.
Okay, Miss Suarez. I'm just going to go wash my hands. I'll be right back. Okay. Do you have any allergies?
No.
Okay. Have you had any acute or chronic pain that you're been complaining of?
No.
And have you had any thoughts of suicide or depression in the past 2 weeks?
No.
Any falls in the past 3 months?
No.
Any dizziness or lightheadedness that you have felt here and there?
No.
Okay. So I'm gonna have you do is I'm gonna have you stand up. Can you just close your eyes and just stand straight? I'm checking. Just keep your eyes closed. I'm just seeing if you're checking for Romberg's test to see if you sway. Okay, you can open up. If you can go walk to your right and then come on back and turn around. Okay, and then take a seat. So I'm gonna assess your face. I'm gonna check your face for symmetry. I'm gonna palpate your head, check for any bumps, any depressions in your skull. I'm gonna look at your face, check for symmetry, check for your eyes are in the same spot, your ears are in the same spot, and that your lips are symmetrical. I'm gonna check for any drooping in the face. I'm gonna check it at rest, then can you smile for me? Okay, and then stick out your tongue. Okay. I'm gonna take a look at your outside of your eyes. Have you look up and take a look at your cornea and your sclera and the conjunctives and look down. Okay. I'm gonna shine a light to your eyes. Just keep looking straight. Okay. Your eyes are equal to reactive to light and accommodation. What I'm going to do is I'm going to check your cranial nerve 2, and then what I'm going to do is I'm going to have you cover one of your eyes, and then look straight ahead, and if you can read me what that says.
FGT.
Okay, and then turn this one, and then do the same with the other eye. And can you read what it says?
FGT.
Okay, perfect. Okay, you put your hand down. So I'm going to check your cranial nerve 3 and see if you can follow my pen. So what I'm going to have you do is I'm going to check your 6 gazes. Follow where my pen goes. Okay, and then can check for convergence. Just follow the pen. Okay, perfect. I'm going to have you look up. I'm going to take a look at your neck. Palpate to make sure I don't feel any bumps. I'm going to have you swallow. Good. And then what I'm going to do is I'm going to have you open up your mouth. Check the inside of your mouth, open. And look at your gums, your teeth, and your oral mucosa. Right now they're all pink. There's no signs of bleeding in it. What I'm going to do is I'm going to have you shrug up your shoulders and push against my arms. Perfect. There you go. And then what I'm going to check now is I'm going to check your neuroassessment. Can you please tell me what year it is?
2019.
Okay, and do you know where you live? What town?
Nyack.
Okay, and your name is?
Angela.
Okay, perfect. You know what I'm doing to you today?
Yes. An assessment.
Okay, perfect. Okay, so what I'm going to have you do is I'm going to have you put your arms out. I'm going to check for any tremors. What I'm going to have you do is I'm going to have you push against my hands. And now push up against my hands. Push up with your palms. Okay, perfect. I'm going to squeeze both your hands and then make sure they're equal. Perfect. And what I'm going to do is I'm going to have your arm lay straight. I'm going to check your flexion. I'm going to have you bend your arm from your elbow all the way up. And then just straighten it all the way down. Good. What I'm going to do is I'm going to check your cerebellar function of your upper extremity. What I'm going to do is I'm going to do it by checking your finger to nose test. So what I'm going to do is I'm going to have you use your right index finger and touch your nose. And then touch my finger. Touch your nose, touch my finger, and keep going as fast. And then you're going to keep doing different parts. Keep going. Perfect. Now I'm going to check your cerebellar function of your lower extremities. What I'm going to have you do is I'm going to have you put one heel of your leg and put it down your shin. And do it to the other side. Okay, good. I'm next gonna check your respiratory. I'm gonna listen to the different sides, lobes of your lungs. I'm gonna check your clavicle for the apex of your lungs and have you take a deep breath in. And breathe out. Breathe in. 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 Breathe out. Check the base. Breathe in. Breathe out. Same on this side. Breathe in. Breathe out. I'm gonna listen to the back of your lungs. Take another deep breath in. Okay. Breathe in. Breathe in. Okay. Breathe in. Okay. And I'm gonna take a listen to your PMI of your heart, which is the point of maximal impulse. What I do is I look at the fifth intercostal space, midclavicular, and listen to your apical heart. Okay. Heart rhythm is regular and your heart rate is 70. I'm gonna check your pulses, check your carotid. Pulses are palpable. Check your radial. Okay. And then I'm gonna check your popliteal, which is behind your leg, behind your knees. Okay. Then the dorsalis pedis, which is on the top of your feet. And the posterior tibial. So your pulses are palpable in all places. Do you ever have any shortness of breath?
No.
Any trouble breathing when climbing upstairs?
No.
Can you take another deep breath in for me? Okay, breathe out. Perfect. So what I'm going to do is I'm going to have you lay down. And what I'm going to do is I'm going to take a look at your abdomen. What I'm going to do is I'm going to take a look at your right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. I'm going to inspect the umbilicus and your stomach for any striae and any redness, swelling, or tenderness. I'm going to listen to your bowel sounds in each quadrant, making sure that you have 3 to 4 bowel sounds in each one every minute. I'm going to palpate. How often do you have a bowel movement?
Every morning.
Okay. And is your stool formed, loose, or soft?
It's formed.
Okay. Any issues with having a bowel movement? Any constipation?
No.
And what do you typically eat as your diet?
Vegetables, proteins like meat and chicken, not so much dairy, tea.
Okay. Do you have any nausea or vomiting ever?
No.
Okay, good. And then regarding your urinary system, when you pee, is your urine what color?
Yellow.
Yellow? Any cloudiness or clear?
Clear.
And do you have any burning or pain sensation when urinating?
No.
Okay, perfect. And then what I'm going to do is I'm going to take a look at your skin. Look for any bruising, any redness, swelling, or rashes. You have no rashes, lesions, or incisions. And I'm gonna check your bony prominences for any pressure injuries, which would be behind your elbows, behind your heels, and then on your sacrum and your hips as well. And then you have no surgical drainage, no IV sites, and no scars or moles. Okay. Do you have any questions for me today?
No, okay.
All right, thank you.
Thank you.